Hello, my name is Dr. Manish Dev. Can I confirm your name and age, please?
My name is Amy Smith, doctor, and I'm 58 years old.
Hello, Mrs. Smith. Thanks for coming to see me. So, how can I help you today?
Oh, thank you, doctor, for seeing me. I have an embarrassing problem, doctor. I'm sorry to waste your time.
Oh, that's totally all right. I thank you that you care. Just book the consultation, even if you are embarrassed. Please be open and please, you are free to say anything to me. I'm here to help you.
Thank you, doctor. Yeah, that's reassuring. Yeah. Doctor, I have few occasions where I have wetted myself. I have problem with passing
Okay.
urine. I don't know. I think I'm going very often, and sometimes I cannot control myself, doctor.
Okay, so I can see, yeah, this is one of the common problem. Can you tell me a bit more about this?
So it has been happening for a good few months, doctor. I mean, at least for maybe 8, 9 months. I have noticed that I go to the loo more often, and sometimes I wake up at night to pass urine as well. And believe me, doctor, if I don't rush, I cannot hold it. It's very very stressing, doctor.
Okay, so does it um okay, so does it you pee in the before you reach to the toilet? Is that right?
Yes, doctor. Yes, that's right.
Okay, so just couple of yes no questions that may be related to this condition. Okay,
Okay, doctor. Yes.
okay. Do you have any burning micturition?
Uh, what is micturition?
Oh, sorry. Okay, so do you have any uh, pain or burning sensation while you pee?
Oh no, doctor. No, it doesn't hurt. No.
Okay, do you feel like something is coming down from your front passage?
No, not really. No.
Okay, so do you have any fever?
No fever, doctor. No.
Okay, so you said that you are having this couple of months. Before that, was it everything fine?
Yes, doctor. Yes, yeah.
Okay, do you have any past medical condition?
Uh, no, I'm quite fit and healthy usually. Yeah.
That's really great. Okay, so any medical condition in the family?
Uh, I think. Let me think, doctor. Yeah. I think my father he had heart problems, and my mother she had a stroke as well when she was 80. And I remember my niece as well. She had eye infection when she was a child. They told her it's a chlamydia eye infection when she was a child.
Do you take any medications?
No, doctor. I don't take any medication.
Are you okay? Are you allergic to something?
I'm allergic to strawberry, doctor. Yes.
Okay, so a couple of questions related to your life that may have some impact on this. Okay,
Okay, doctor. Yes.
do you smoke?
No, doctor. I don't smoke.
Do you drink alcohol?
Uh, yes, yeah. Usually I drink wine every night.
Okay, so are you sexually active?
Yes, doctor. Yes, I'm sexually active. Yeah.
Okay, so are you having any problem with that?
Yes, doctor. Yes, my husband has been complaining as well that sometimes I smell of urine because sometimes I can't hold it, and it has been putting us off from the sexual activity, doctor.
That must be very embarrassing. Okay, I will see what we can do for it. Okay, so what do you do for living?
I work as a teacher, doctor.
Okay, so has this condition affected your day-to-day activities by any way?
Yes, doctor. Yes, I had to take some time off work, doctor, because it's very embarrassing. When I teach students, I need to rush to go to the toilet, and I'm afraid if I if I wet myself while doing any classes.
That must be very hard for you to deal with that. Do you have any idea what might be causing these all symptoms?
I'm not quite sure, doctor, but it has been very stressing for me, doctor.
Okay, are you expecting something from us today?
If you can give me something to help a doctor, some medication to stop that, that would be very helpful.
Yeah, sure, we will figure it out. Okay, now I'd like to examine you. Okay, um, maintaining your privacy, we will keep the chaperone and like to examine your tummy and do some uh, blood investigation and urine investigation. Okay.
Okay, doctor. Yes, yeah.
Okay. And based on your history and examination, I suspect you have a condition called urge incontinence. Have you heard about it before?
No, doctor. What is that, doctor?
Okay, so this is a condition in which your bladder muscles are overactive, and that is the reason whenever you feel like to pee, you have to rush to the toilet and you can't control it. Does that make sense?
Yes, doctor. Is it serious, doctor? Can you treat that?
I can see you are worried about this condition. Yeah, this is not a very serious condition, and we can do a couple of things about this. Okay,
Okay, doctor. Yeah. What is that?
there are a couple of things you can try by yourself at home. Okay, and if it doesn't work, then we can provide you with some medicines and some other treatment options. What do you like to discuss about first?
If you can tell me about the medication, doctor, if there is any medication to help me.
Okay, yeah, sure. Uh, we can give you medicines which will relax your bladder muscles. Okay, what we call it oxybutynine. Okay,
Mm-hmm.
and but this medicine will not work by itself without any lifestyle modifications. Does that make sense?
Yes, doctor. Yes.
Okay, you should try the bladder training. Okay, have you heard about it before?
No, doctor. No.
It's like whenever you feel like to pee, just hold it for a few seconds, okay, by
Mm-hmm.
contracting your pelvic muscles and hold it till you can. And even if you reach to the toilet, just have some control and hold it to the maximum you can, and then only start pee. This is what we call bladder training, okay?
Okay, doctor. Yeah.
Do you have any concern?
So, will I do that myself? Like, will I have any guidance how to do that? I'm not quite sure if I can do that myself without any guidance.
Yes, of course, we'll provide you with the leaflet, okay?
Mm-hmm.
Which will include all the details about this bladder training and how to exercise it by yourself at home. Okay.
Okay, and will you give me
And
the
you can
medication,
try.
doctor, to help with that?
Yes, of course. If this doesn't work, then we'll prescribe you medicines that will be helpful to you. Okay. So now I'd like to talk about some warning signs. If you notice that, you need to come back to us immediately. Are you happy for me to discuss that?
No, doctor, you can't. You finished your time. All right, my
So,
dear. Thank you. Thank you for being my
thank you.
first candidate. And we'll start with giving you the feedback. So overall, you have good knowledge, yeah. So you have pretty good knowledge about the condition. But let's give you the feedback about every domain, yeah. So the first thing, I will ask a question to everyone to answer in the chat box. What was your diagnosis here? And you can answer as well, Dr. Manish, in the chat box. What was your diagnosis here? Anybody knows the diagnosis for this case? Okay, lots of wrong answers. Okay, so why did you say it's urgent incontinence even though you didn't rule out the differential? Why it is not a stress incontinence? Why it is not a mixed incontinence? Yes, this case is an urgent incontinence, I know, but you cannot diagnose urgent incontinence if you didn't take a proper history. So the first major mistake you did, you never asked me if I have any problem with passing urine or any leaking or coughing or sneezing or laughing, because it can be basically a stress incontinence case, or it can be mixed incontinence, which is very common as well. So having not proper or not complete data gathering ended up in wrong diagnosis, or at least not safe diagnosis, because this may be a missing diagnosis here. Okay, so I'll give you a feedback about your data gathering first here. Unfortunately, your data gathering were lacking many important information. Let's start with data gathering here. As I always say, start data gathering by open question to listen to the presenting complaint. You did that. I gave you a good story about my problem passing urine, and you listened carefully and you gave good sympathy and empathy. I give you that. After that, I always say invest more in the present and complaint, explore it more. Ask the patient, can you please tell me more about that, or how long it has been happening for, or can you describe how does it happen? Okay. In this particular occasion, you need to complete your present and complaint by ruling in or ruling out stress incontinence. So Amy, you mentioned you have problem with rushing to the toilet. Did you have any incident of passing urine with coughing or sneezing at all? Yes, doctor, or no, doctor. Then she will guide you. No, it's not a stress incontinence, or yes, it is a stress incontinence. So you needed to verbalize that question very clearly. That will be the first minute or the first step in your data gathering, which is exploring the presenting complaint and differentiating it between urgent incontinence or stress incontinence or mixed incontinence. Yeah. That will be very quick, will not take a minute. Yeah. Then the second step will be close the specific questions to rule out differentials. So the first differential that came in your mind was UTI. I give you that, but you did it in the wrong way as well. You asked me, do you have any burning micturition? What is burning micturition for someone who is not working in medicine? Yeah. So that was classified as a medical term. You can ask any pain with passing urine. Does it burn? Does it sting with passing urine? So use simple language because I will cut this mark for you. Second thing, when you ask about a differential, you need to show the examiner that you have a structured approach. So what do I mean by that? For example, you asked me any burning micturition, I said no. Then what was your next question? You asked, do you have any bulge down below? I mentioned no. Then you came back, do you have any fever? So what does that tell the examiner? That the first question you was trying to rule out UTI. The second question you was trying to rule out prolapse. The third question you was trying to rule out UTI again. So that was unstructured approach. So when you are asking something, you should be asking it for a reason. So when I ask about UTI symptoms, I will finish them and then go to my second differential. If I finish my second differential and I need to rule out something else, I will go to the third, or I will move on to my next step. So this is how to show structured approach. So Amy, do you have any pain with passing urine? No, doctor. Any spiking temperature at all? No, doctor. End of the story. Then go to your second differential, for example. Okay. When was your last menstrual period? Have you noted any lumbar bulging down below? So this will show the structured approach. So anyway, you ruled out UTI, but not in the perfect way. Second important differential here, someone going to the loo more often during the day, during the night, polyuria, what will be your differential diagnosis here? What is the common medical condition that you all ask in every single station? I don't know why, but you like to ask about it, which you can present with polyuria. Diabetes, why you didn't ask about diabetes? You didn't ask about diabetes, and even in past medical history or family history, you didn't specify diabetes, which usually every one of you like to do that, but I don't know why this time you didn't do. Anyway, diabetes was one of the differentials. So you can ask about diabetes like, do you feel more thirsty or any other associated symptom? The third differential here will be very important. And the third differential here is women issues. You need to ask about women history or women issues. That will include the last menstrual period. You need to know if she's menstruating or she's menopausal, because that is common in postmenopausal lady, the incontinence. Okay. And when you ask about last menstrual period, you can ask about any bulge from down below. So you will cover the gynae problem by asking about period. When was your last menstrual period? Any bulge or any lump coming from down below. The third and the last differential here, which will be very relevant, is asking about cancer questions. Why? Is it because I like cancer questions? Is it because it's a routine question? Nothing is never a routine question because cancer can cause incontinence. Okay, so I will ask about any unexpected weight loss or maybe any back pain or constipation. That will be a quick focused history, and this is what we say by organized history. First minute, I will listen to the golden answer of the patient. I will explore what kind of incontinence with that. Second minute, my second step, close the specific questions for differentials or red flag. What will be that? UTI? Yes, two quick questions. And then gynae questions? Yes. Last menstrual period and any bulge from down below. Diabetes? Yes. And then cancer, any unexpected weight loss. That will be optimum in that case. And then the third step, you asked about maftosa, or what you like to call maftosa. I hate calling it maftosa. I call it general well-being of the patient, or I call it relevant maftosa. If it's not relevant, please don't ask it because you are a professional. For example, you asked me, do you have any past medical history at all? I mentioned no. That's fine. I give you that. And then you asked me any family history of any medical problem. What did you do by that? You wasted your time. What do you mean by any family history of any medical problem? By the way, my brother had COVID last week. Is it making any difference for you? My sister, she had a child with viral infection. She had chlamydia when she was a child. My father had a fall in his 80s. This is not relevant. You need to be professional and showing the examiner, I am looking for something specific. I'm looking for something relevant. So any family history of bladder problems, any family history of diabetes, any family history of similar complaints, always make your station serving you, okay? Because you are not a student, you are a doctor back home. And then when you asked about allergy as well, try to avoid being very broad or very wide. Any allergy from anything? Yes, I'm allergic to strawberry. Are you going to give me strawberry today? No, you are not. So this is waste of time. I may not cut marks for you, or I may not cut marks from you because of that, but you are wasting a very valuable time for yourself. Okay. So when you are specific, you are saving time to ask a relevant question. If you would like to ask about allergy, be more specific in allergy to medication. Lifestyle questions were very important, and you mentioned that, which is very good. Sometimes lifestyle habits can affect our waterworks. For example, you mentioned something similar, and you asked about smoking. I wasn't smoking. That's very good. You asked me about alcohol. Is alcohol important in this case? Yes or no? Yes, it's very important because it can work as a diuretic. It can irritate the bladder. It can cause more incontinence. But when you asked me about alcohol, did you show any care for that? I told you I drink wine every night. Did you ask me how much do I drink? Is it maybe I drink one sip of wine, or maybe I drink one bottle of wine? It does make a big difference, right? So you needed to show commitment to the relevant information, not just asking it. Okay. Caffeine is very important with alcohol here. So the relevant lifestyle questions here will be fluid lifestyle. Okay. Caffeine, coffee, water. And then the last step in data gathering is always psychosocial and ICE. Psychosocial, you asked about psychosocial, how that has been affecting you. I told you it's affecting my work. So very well done for that. When you ask about psychosocial, you will need to ask about social will mean family or home. So remember to ask about kids. Do you have any kids at all? Have you delivered them by vaginal delivery? Is that relevant information? Yes, that's a risk factor for incontinence. Having frequent vaginal deliveries can weaken the muscle and can cause that. So do you see what I'm trying to do? I'm trying to make everything serving me. And then ICE, you asked ICE, so very well done for that. But I told you my expectation on ICE. What was my expectation? I wanted some medication to help me. And do you think ICE is a routine question? You can answer yes or no in the chat box. Do I ask ICE in my mind maps because they are routine questions? No, they are not routine questions. They are relevant questions. Because if the patient coming to you today because of 7, 8 months history of incontinence, she is coming today because she has a problem, and this problem is affecting her life. So when the problem is affecting her life, she is coming to see a doctor. I have headache today. Am I going to see my GB? No. You have headache as well because you have an exam coming soon. Did you go to see your doctor? No. You start to see your doctor when you have some major impact on your life, or you have some idea or concern in your mind and you need some reassurance or something to be done for that. So asking ICE is relevant. So you did that. I'm not cutting you markers for that. But when I say something positive on ICE, for example, I'm expecting you to give me medication. Is that the end of the story? Do I need to stop here? No, you will not get the mark until you address that back in your management. So if you do not address ICE in your management, it wasn't worth asking it in data gathering, because it's not a routine question. It's not a tick box exercise. And this is what happens in Blab too. Many good candidates go and they say, I asked everything, I followed the notes 100%, and then they fail. Why? Because it's not a tick box exercise. It's just a chat with a patient, and you need to be listening carefully and addressing that back. So anyway, you asked ICE, but you didn't address it back. So that was data gathering. Yeah. So unfortunately, I will need to cut decent marks in data gathering for many reasons, because you didn't differentiate between urgent stress incontinence. In your differential, you didn't show structured questions in differential, and as well, you didn't rule out important differentials such as cancer questions and period questions. Yeah. As well, in your general history, you didn't show me the relevancy of them. You asked them in a very broad way and you didn't link them to the problem. Yeah. Okay. And as well, you forgot about deliveries and the pregnancies, which was very relevant. Yeah. So that was data gathering. Yeah. Let me tell you about the IBS skill. Okay. Or interpersonal skills. You started very great with interpersonal skills, but then unfortunately you didn't keep that level. Yeah. You started with reassuring the patient. Very well done for reassuring her about the embarrassing problem. Very, very well done. And you give her good sympathy and empathy in the beginning. So you started very strong. But then during the whole consultation, you have been very quiet. You have been very slow. You have been very monotonous. So that even made me, as a simulator, very sleepy. I don't like to be sleepy or talking in a sleepy manner, but you made me feel that way. That was, you can make that more easy by giving more energy to your consultation. Okay, interacting more with the patient. When she's giving you something positive, you are reflecting on that, or you are following that up. This is the first thing. What else will cut marks for you in interpersonal skills? Using medical terms. Micturition wasn't a good word to use. As well, being very broad, like saying I will do blood and urine investigations. What is blood and urine investigations? Are you testing my urine for what? Like, is it just for, would you like to look at the color of the urine? Would you like to do send the urine for STIs? For what reason? I'm a patient. I have a right to know. Okay, and the blood. What blood is that? Is it blood for STIs, for example? Is it blood for cancer markers? Is it blood for, I don't know for what? You didn't tell me. So being very broad will cut marks as well. Second thing in interpersonal skills, not actively listening will cut marks for you. Why? I told you I had this problem for 8-9 months. And at one point you told me, okay, Amy, you had this problem for a couple of months. Couple of months, I said 8 months. So that means that you didn't listen to me when I gave you the duration. Yeah. So the examiner is listening to everything you say. So don't think that he didn't listen to that. So I did listen to that, and you mentioned the wrong duration because you didn't listen me carefully. That will cut marks as well. Yeah. All right. So let's go to examination before we go to management. Yeah. So when you examine as well, you mentioned I will examine your abdomen and vitals or something like that. Be specific. What we are examining here, we are examining the abdomen and the pelvis. Yes, because we can look for a lump if there is a cancer, or maybe palpable bladder if there is a retention. We need to examine her from down below because prolapse is a common problem to cause that. And we need to examine her weight. Why? Is it because measuring weight is routine? No, because weight is relevant. Overweight is a risk factor, or obesity is a risk factor, and it's one of the management. Yeah. I will take a urine sample. Is it because I like to take urine sample from my patient? No, because I need to look for blood, for example, if cancer causing that, for infection, or testing bedside urine testing. So that was your data gathering and interpersonal skills. Let's go to your management. Management starts with a diagnosis. You gave me the right diagnosis, but in the wrong circumstances. So it is the right diagnosis, but you didn't have enough information to reach it. You mentioned you have an urge incontinence. I'm not quite sure that you are sure it's urge incontinence because you needed to rule out stress incontinence. I have said that already. Yeah. Okay. So if I do the history in the right way, I will say then, having listened to you, having examined you, Amy, I think what you got is urge incontinence. Have you heard of that before? No, doctor. Yeah. So I can then explain it in a simple way. Simply, it means overactive bladder, where the bladder is squeezing when it shouldn't do, causing you the urge to go. Okay. Investigation, yes, you can offer investigation, but don't say I will do blood test for everything. No, you are a professional. When you are doing a blood test here, you're looking for something specific. Maybe you're looking for glucose because diabetes is a differential. Maybe you're looking for kidney function because she's coming with water works problem. Yeah. So be specific. Management wise, what is the first step in management? Let's see what you did here. You did very right in the beginning. You told her that we have a lot to help you with, things you can do, things we can offer you. You had a very good medical knowledge. To be honest, theoretically, you are amazing. So you have very good medical knowledge, but you didn't place them to the same patient. So the same patient coming for expectation of having a medication. So she is asking mainly for medication. So you needed to bring her expectation back. So I do understand you are keen to start some medication to help with that. Let me reassure you that medication is an option, Amy, which we can consider. But having said that, we have still few things to try before taking medication. Would you like to hear about what we can do? Yes, Doctor. Yeah. So the first thing that we can do, few things you can do in your lifestyle. And unfortunately, you didn't have time to talk about lifestyle. You talked about bladder retraining, very well done. But as well, try to be, I think the main error that you do, you try to be very broad, you try to be very general, and you forget to be specific. For example, when you talk about bladder retraining, I didn't understand. Do you mean I will do it myself? Will I need to be referred to someone to do that for me? Will it be forever? Will it be for 1 week? I didn't understand. You just mentioned squeeze your bladder and do that. Will I do that forever? Will I do it myself? Will you refer me? I don't know, because you didn't give me the right information. Just give me a very general information. And then you mentioned about medication. You can take oxybutynin, it takes time to work. And then I didn't understand, will you give me the medication or will you wait for the first lifestyle to work first? So you offered it, but you were very general. I didn't understand what are you going to do. You got my point? It's like you are ticking boxes. I mentioned the medication, I mentioned the bladder retraining, I mentioned the safety netting. It doesn't work like that. You need to place the consultation to the specific patient here. And you need to be very specific what I'm going to do today and what else I'm going to do after today. Okay. So overall, I'm not very worried about you because you have very, very good knowledge. I think theoretically you know a lot about the condition, but you need to place that to be directed to the patient. You need to be listening to the patient and getting this information from the patient and using it back here. So overall, very well done. I'm sorry if I'm a little bit harsh, but this is for the best interest for you because I would like you to be the best as you can in your exam and because I care for you. So sorry if I am a little bit harsh here. What I will do now, I will go and cover the whole mind map from A to Z in less than 8 minutes here. So I will show you how to cover that mind map or that case in 6 minutes only. And this mind map will cover every case of incontinence. You do not need to study incontinence in 10 pages. Only this mind map will be enough. Is it because I'm a magician? No, I'm not a magician. This is because it's all based on UK practice and the NICE guidelines. So this is what I do in my clinic every day if I have a lady coming with incontinence here. So let's do that together. So the patient will be coming with an embarrassing problem because she's wetting herself. What will I do? I will not do anything. The same structure I use in every mind map. I will explore the presenting complaint by asking an open question to listen carefully to the patient. Amy, please don't feel embarrassed. I'm here to listen and help you as much as I can. Feel free to talk about anything. Give her any reassurance line. That should be fine. Can you tell me more about that? So start with an open question about the presenting complaint. She will mention as much as she wants. Doctor, I have problem with wetting myself for the last 5 months. It has been embarrassing, affecting my job, affecting my sexual life. Listen, don't interrupt her. After you listen, do you need to move on? No, still invest in the presenting complaint. And why do I need to invest in the presenting complaint? Because the more you invest in the presenting complaint, the more you save time from ruling out 100 differential. Because if you stop the patient because you are keen to ask your notes or your academy notes, you are actually wasting a lot of time because you still need to rule out lots of differential. But if you listen to the patient, she will guide you to one specific medical condition. So she will save time for you because you will not need to rule out many differentials. So anyway, let's go back. Open question to listen to the golden minute. After that, I will still explore the presenting complaint, how long this has been going for. Explore what kind of incontinence is that? Is it stress or is it urgent incontinence? So, Amy, do you have any leaking of urine when you cough or sneeze or laugh at all? No, doctor. If she says yes, then you can think about stress incontinence. Okay, I will cover stress incontinence at the end as well because it will be the same mind map. That will be my first good minute or 2 minutes here. My second step will be close the specific question to rule out what? Differentials and red flag. What will be the first thing to be ruled out here? UTI. And when I ask about differential, will I be haphazard? Will I be ask one symptom and then come back to it again? I never do that because that will be unstructured approach. So Amy, with that, do you have any pain with passing urine? Have you noted any blood with passing urine at all? Any spiking temperature? Yes or no? One or two questions about UTI, and that will be negative here. Second differential, what can cause polyuria and nocturia? Diabetes? Yes. I may ask her about, do you have any history of diabetes at all? Do you feel more thirsty? Just one question, yeah. And then my third differential will be gynae problem. What gynae problem is relevant here? Prolapse? Yes. Menopause? Yes. So when was your last menstrual period? Doctor, it was 10 years ago. Have you noted any bulge or lump coming from down below? No, doctor. As simple as that. The last differential will be the cancer questions because cancer can cause incontinence. So I may ask her about any unexpected weight loss or back pain. Just one or two questions. That will take maximum 2 minutes of your history or 2.5 minutes, which is pretty easy, okay? Then my third step, is it maftosa? I don't like maftosa. Amidal Saidi doesn't like maftosa. I like relevant maftosa or relevant general well-being. I will place the patient history to serve my consultation. So Amy, Do you have any similar problem in the past? Any past medical history of similar complaint at all? No, doctor. Have you been using any medication? Why medication? Because sometimes medication can cause incontinence as a side effect. Like for example, diuretics medication and psychotic medication. So when I ask them, I'm looking for the relevant information. Amy, any family history of similar problem or bladder problem or diabetes? Not family history of chlamydia in childhood. So I will not be general and I will be looking for specific information. Then lifestyle questions, very, very important, especially fluids in lifestyle. Smoking, yes, is a risk factor. I'm not smoking, doctor. Do you drink alcohol? Yes, I drink. Will I move on? No. If she's giving me a positive symptom and I'm listening to the patient. Why I am listening? Because I am caring to listen to the information. So if she's giving me information, I need to follow up that information. Because if I don't follow up that information, why did I ask it in the beginning? Okay. So everything should be for a reason. Yeah. Yes, I drink alcohol, doctor. So can you tell me how much do you drink? Doctor, I drink half bottle of wine every night. Is that relevant? Yes, alcohol is a trigger, is irritant. Alcohol is causing incontinence worse, so I can advise about that. How about caffeine? How about water? Relevant information. Yeah. Then I always finish every mind map, every data gathering with what? Psychosocial and ICE. And am I asking that because it's a relevant question? It's never a routine question. It's always a relevant question. Because if the patient is coming to the GB, she's coming for two reasons. Because this problem has been impacting her life, which is psychosocial, and because she has some thoughts in her mind, which can be idea or concern or expectation. So I will always ask that because I know I need to use them. So Amy, this has been happening for 8 months. How that has been affecting you? Has it been stopping you from doing anything you used to do? Yes, doctor, I work as a teacher. It's affecting me, blah, 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 blah. Listen carefully. Okay. And how about things at home? Do you have any kids at home? I have 5 kids, doctor. All right. Yes. So how was the delivery for your kids? Was it a vaginal delivery then, or did you have C-sections for them? So she will tell you, doctor, I had 5 vaginal deliveries. Is that relevant? Yes, that can weaken the pelvic muscles, can cause incontinence. So everything is happening for a reason. And then ICE. What do you think may be causing that for you, Amy? Is there anything specific worrying you the most? Expectation. Were you hoping for anything I can offer you today? And if the patient is giving me a concern or expectation, is it the end of the story? Is it a routine question and I should stop here? Never. If the patient is giving me a concern, if the patient is giving me an expectation, I will need to use that back in the management. Otherwise, don't expect to pass management. Okay? And you can find a lot of these examples in my IBS session if you have it in the package. Anyway, that will be my data gathering, and believe me, that will be maximum of 4 minutes. And don't exceed 4 minutes in data gathering, please. Yeah. Examination will be relevant examination. If you tell me I will examine you head to toe, believe me, if I am the examiner, I will fail you. I will at least have a very bad impression about you. We don't examine anyone from head to toe. This is not medicine. I don't have time to examine someone head to toe. Yesterday, I had 30 patients in my clinic and I was on call in my clinic. Yeah. So do you expect me for 30 patients to examine them from head to toe? I don't have time. The consultation is 7.5 minutes for me. I can't do that. So I always examine relevant examinations. I would like to examine you. That will include me examining your tummy. I would like to examine your private area, your vagina as well. I will have a chaperone with me, and we will examine your weight as well, Amy. And we can have a urine sample if you can bring a urine sample, or if you can give us a urine sample. Why? Because these are the risk factors. Abdomen and pelvic for what? Because palpable mass or palpable bladder can be cause for that. MCU for what? Because I can test for protein, for blood, for infection. Weight for what? Because overweight is a risk factor, so I can advise about losing weight. Anyway, just to be relevant in your examination, I think you understand what I mean. Then I will give my patient a diagnosis, and this will be minute 5 maximum. Okay? Having listened to you, Amy, having examined you, I think what you got is urge incontinence. Have you heard of that before? No, doctor. So simply, Amy, this means overactive bladder, which means your bladder is squeezing when it shouldn't do, causing you the urge, desire to go. As simple as that. Avoid any medical term. If you try to be smart and you try to be very I don't know, very educational, and you give me some medical terms, you will lose marks for using medical terms. So how we can help you with that? Start your management by giving option. There are a few things we can help you with that, Amy. There are a few things you can do yourself and a few things I can offer you. I understand you were hoping for medication to help. Yes, there is a medication that we can use to help, which I will be discussing with you. However, there are other things which we usually do recommend to start with. Would you like to hear about them? Yes, doctor. So things you can try yourself, Amy. So reducing coffee and alcohol intake will massively help your water habits because they work as irritant and they increase your ability or they increase the frequency if you're going to the loo. Would you consider doing that? Yes, Dr. Yeah. And Amy, we know that losing weight or reducing weight can help with controlling the water works as well. What do you think about reducing weight? Will you be happy considering that? Yes, Dr. Yeah. And then you can ask her about doing a bladder diary, and she can do that for 3 days, mentioning how many times she goes to the loo, what was the trigger, how many fluids she had taken. Just mention diary, and you can say, I will print a diary for you. You can fill it in, and then we can have a follow-up after that. So this will be the things that she can do herself. Things that I can do to help you with that, Amy, we can refer you. So she will not do it herself at home. You can refer her for what we call bladder retraining. Okay, exercise or body training program that can usually be done by incontinence nurse or physiotherapist. Yeah. So you will refer for bladder retraining. That does take time. You will need to have that for at least 6 weeks, which can help over the long time to reduce the frequency of you going to the loo. Will you be happy for me to start that referral for you? Yes, doctor. Yeah. I understand you wanted medication. Yes, there is a medication we can use if these two things didn't happen. So we will be indeed considering giving you medication. Doctor, tell me about the medication. Tell her, it's fine. If she wants to know, tell her. Medication is called oxybutynin, or it's a medication to reduce the frequency if you're going to the loo. They do take some time to be effective. So we usually wait for at least 4 weeks to have some effect from the medication. And as you mentioned, or as you know, every medication comes with a side effect. So this medication can commonly cause dry mouth or constipation or dizziness. So they make everything dry. Dry mouth, they dry you from the bowel, so you get constipation. Dry you from water, so you get treatment for incontinence, and they can dry you and cause dizziness. Yeah. So anyway, just a side effect: dry mouth, constipation, dizziness, and then, doctor, if that didn't work, what else can you do for me? Amy, let me reassure you that even if that doesn't work, we still have other options to consider. We can consider different medications, and if needed, we can consider referring you to the specialist, and the specialist will have different options as well, including surgeries or including injection in the bladder. Okay. Safety net the patient, arrange a follow-up. I'll be happy to see you again, maybe in 1 or 2 weeks' time, to see how are you doing with these changes. Yeah, as easy as that. How many minutes you need to do that? Believe me, 7 minutes will be enough if you are relevant and to the point. So thank you everyone for listening. This mind map is for free, so you can use it, and it should make your life more easier. And if you like to join my mind map package, we have a full package of mind maps which covers every single case that came in Lab 2 before. So it has around 400 mind maps for every single case, and every single case is similar to the previous one, will be covered in 5-10 minutes maximum, giving you all you need in relation to the guidelines. So nothing is imaginary. Everything is based on NICE guidelines and based on what we do things in UK, because I do these cases daily in my clinic. As well with the package, you will have access to the IBS mechanics session and the management mechanics sessions and the cases simulation and the feedback on them, and SimMan teaching. Everything is included. Yeah. If you like to join, feel free to contact me.